All right. Hi, everyone. My name is Kristen Tyree. I'm an MDC coordinator at the Vera and Jayhawk building for upper tract urothelial cancer, MDC. And today I'm going to be doing a very brief presentation and kind of overview of my time at ONS. I'm going to be emphasizing the mental health aspects more so than anything. I will, however, send the presentation to Chantel Meyer and Jeanette Almonte, who can disperse it to you as well. This will be kind of a wham bam thank you, ma'am, going through it kind of fast because I know it's very valuable information, but your time is also valuable as well. I'm going to go ahead and share my screen and we'll talk about mental health because that is what May is all about, and oncology nursing month, actually. So I think that's wonderful. Real quick, sorry, let me get to it. There we go. Okay. And then real quick, making sure that looks good. Okay. So as mentioned, this is me, Kristen Tyree. I am the MDC coordinator for urologic oncology. Here was my itinerary. I'm not going to spend too much time on it. The ones that are starred are the favorites that I went to and I'll be presenting on. Here's some pictures. I like that they had photo ops for everyone and everyone really enjoyed it. Here's the topics I chose to present and why. I'm going to kind of talk about them more at length, so I'm not going to linger on this slide too much, but for reference, here's why. And I really will be hitting on the trauma-informed communication, nurse sustainability, and the certainty of uncertainty talk. Here's the lily of the valley. And I want people to know that as I'm doing this talk or as you see this presentation, my intention for it is joy, luck, happiness, sincerity, and love. I hope that anything I say is received so well. And nurses, especially oncology nurses, know how much I admire you. And I know this is a hard field and I love being in it and I know we all do, but it's very difficult, which is why we would need to talk about trauma-informed communication. During the talk, they interviewed a huge room of us, about 100 to 200 nurses were in it, and 77% said that they had struggled with child abuse. As their own, like as a child, they went through that. So it gave me this realization that, and I know we talk about it, but not everyone has been through similar things, but a lot more people have things in common than they realize. And I thought that was very important because having trauma-informed care, we already do it with patients, but we don't do it with nurses. And I think it really leaves a lot to be desired because we should be supporting each other. So the foundations of trauma-informed care is safety, 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 being trustworthy and empowering the nurse, the patient, anyone. And I think like this is a good stepping stone into trauma-informed care and how we keep nurses safe and happy. Here is a screening tool. I think it's wonderful. I highly suggest everyone look at it in depth. It's a very good resource. The Mara Mogensen Flaherty Memorial Lecture was on nursing sustainability. It talked a lot at length about how about 100,000 nurses left in 2020, not including retirement or like switching fields. They just left nursing. And how nurses are at an increased risk of maladaptive coping, such as smoking, drinking, drugs, overeating, undereating. And the only way to address short staffing is to fix what's wrong. And it's that nurses are not being supported, right? So where I go with this is like just a cute slide. In the ambulatory practice pearls, it's there for reference, but I won't be touching on it during this talk specifically because we're talking about mental health. Once again, a reference. Going back to the nurse sustainability, and they talk about the inescapable certainty of uncertainty. It's a mouthful and it sounds scary, and it is scary, but it's a really good perspective that even if things are uncertain, our relationship with one another doesn't have to be. Nurses are under a lot of moral distress, and the speaker of this talk talked about how self-care is an obligation and a right. How in the healthcare field, there's emotional contagions, whether they're good or bad, that if somebody's anxious, we're usually all anxious. If somebody's happy, we're trying to be happy with them. Healthcare is competitive, but it shouldn't be. We are a team. We need to have compassion, caring. We need to be there for one another. Otherwise, we are going to keep losing nurses, and nurse sustainability is going to be an issue. And it's a very vicious cycle, and it's so stressful too. And he asks the question, what is more valuable, the patient or the nurse? And it's so hard because people initially want to say, oh, the patient, always the patient, right? Because that's what we've been trained to do. However, I thought about it, and we've all kind of talked about it now too. And I think that the perspective to have in this case is that when you value the nurse, any nurse, especially in oncology nursing, that patient becomes the most valuable person in that effort because nurses have empathy. They care and they put their patients first. So by valuing the nurse, it's not that they're cared for more than the patient, it's that they're allowed to facilitate excellent patient care and excellent nursing care, supporting one another. When we value our nurses, it doesn't stay with them. It's dispersed so beautifully and so holistically. That I think it's such an important concept, and I really linger on this one, and that's where a lot of my time's going. But I think that like being compassionate, being caring, having that trauma informed communication to be like, hey, I don't know your trauma, but I know in a room of 100 to 200 very amazing, intelligent nurses, 77% of us went through child abuse, which means there may be things you never talk about and you don't have to share it with me, but I'm going to treat you in a way that one is trauma informed and two is respectful because even if it's not a big trauma, if it's 1,000 little ones and it makes a big trauma, or if it's something that's hard and it hurts you, it deserves respect. And I can guarantee in nursing, if we looked at it, I bet a lot of us would admit to being traumatized. I know I am. So I wish it was talked about more. And I think that we really need to get a system in place about having like a battle buddy, having a person, having someone you can look at and be like, can I be safe with you? And they're like, you can be safe with me. And building that trauma informed communication and that compassion and the care, and that helps increase nurse sustainability and retention, and that helps increase nurses like wanting to stay in the field and then feeling valued, and it all ties together so beautifully, and it was such a wonderful talk. um and I know I'm kind of breezing through these. It's just I really wanted to get this information and kind of open a discussion about it because it is an important topic, and nurses are leaving by the handful still, even in 2023. And so, what I really want to leave you with in this too is I think we need to focus on companionship, compassion, and caring. It will make for healthier people, healthier patients, healthier nurses, and healthier teams. And I want to leave you with this quote from Brene Brown, who I love, that says, no matter what gets done and how much is left undone, I am enough. It's going to bed at night thinking, yes, I am imperfect and vulnerable and sometimes afraid, but that doesn't change the truth that I am also brave and worthy of love and belonging, which nurses, I cannot even comprehend and explain to you how when I read this quote, I wanted to cry because you want to get everything done and do right by people. And you do. This is me like sitting here telling you, you do so much. Please, please, please be sure to take care of yourself. And it's about to be the weekend. It's beautiful. I hope all of you have such a safe and happy and healthy weekend. And if you need anything, please feel free to reach out to me, okay? And I'll make sure Jeanette and them have these and you have all the resources as well, because there's really good tidbits and practice things as well. So happy Mental Health Month, happy Oncology Nursing Month, and everyone please be safe and blessed. Have a wonderful day. Bye.